What if I told you the days after glaucoma surgery can be riskier than the surgery itself? Sounds shocking, right? But the truth is, small mistakes, like lifting groceries, rubbing your eye, or skipping drops, can spike your eye pressure, slow healing, and even lead to serious glaucoma complications. The problem is, most people aren't warned about these traps until it's too late. In the next few minutes, I'll show you the 5 mistakes that can derail your recovery, and more importantly, what you should do instead. By the end, you'll know exactly how to protect your vision and make your glaucoma surgery recovery a success. Stick around, because avoiding just one of these mistakes could save your sight. Mistake number 1. Strain from lifting, bending, or exertion. Right after glaucoma surgery, slipping back into routine tasks, hauling shopping bags, doing vigorous housework, or dropping your head quickly to tie shoelaces, feels harmless, yet each effort can send pressure inside the eye, surging, stressing the fresh repair and slowing recovery. So think of the healing tissue as fine stitch work that needs steadiness rather than force. Which is why your surgeon sets weight limits and advises against bending from the waist. Instead, keep your head above your heart, squat by flexing the knees, bring objects up to counter height before reaching, and favor tasks at eye level, while a simple reacher helps you pick items off the floor without repeated stoops. A step stool avoids awkward stretches, and heavier chores, from carrying laundry baskets to pushing furniture, are better handed off for now, because these small adjustments by GLAUCOMA protect the surgical site and preserve vision. And once you feel how much smoother the day goes with these safeguards in place, you'll be ready to spot the next everyday habit that quietly puts recovery at risk. Mistake number 2: water, cosmetics, and unclean hands near the surgical eye. In the early recovery window after glaucoma surgery, moisture, makeup, and fingers that haven't just been washed can quietly carry germs onto delicate healing tissue. So infection control moves to the top of the priorities list, because even a quick splash from the shower, a passive eyeliner, or a casual face touch can place bacteria exactly where they should never be, raising the risk of complications that slow healing and threaten vision. To keep the area protected, turn your back to the water. While bathing, let the stream hit shoulders instead of the face, and freshen the skin with a soft, clean cloth while keeping the operated eye dry and undisturbed. Then dry gently without rubbing so the incision remains calm and sealed. If cosmetics are part of your daily routine, give them a pause, since brushes, pencils, and mascara wands can harbor microbes, and treat your hands like surgical tools by washing with soap and water before any necessary drop installation. Otherwise, avoid touching altogether. Pools and similar exposures fall into the same avoid for now group because shared water invites contamination. These small choices create a safer environment for recovery, and once they're in place, the next challenge is curbing the almost automatic urge to rub an irritated eye. Mistake number 3: rubbing the eye or sleeping without protection. During the early healing period after glaucoma surgery, a surprisingly common slip is rubbing the operated eye, a reflex many people barely register. Yet even a light graze can push intraocular pressure upward, disturb fine sutures, or compromise a fresh filtering bleb, creating setbacks that slow recovery and invite complications. For that reason, surgeons emphasize a rigid shield, especially overnight, because while you sleep, your hands don't always follow instructions, and the guard quietly blocks pillows, sheets, and wandering fingers from pressing on sensitive tissue, so the repair stays calm and undisturbed. When itching or grittiness builds, resist scratching and lean on your prescribed regimen instead. Use lubricating tears as directed, keep to the anti-inflammatory and antibiotic schedule your clinician set, and let those drops soothe the surface without mechanical stress. If discomfort persists, contact the care team rather than touching the area. By protecting the eye during rest and staying hands-off through the day, you preserve momentum in healing and set yourself up for the next essential habit, keeping every medication dose on time so the recovery stays smooth and your vision stays safe. Mistake number 4: skipping drops or follow-ups. Glaucoma surgery recovery truly starts the moment you leave the operating room, because the stability of vision over the next weeks depends on steady medication use and timely check-ins, as antibiotic and anti-inflammatory drops form a protective line against infection, calm surface irritation, control inflammation, and help keep intraocular pressure in a safe range while tissues settle. So treat the bottle lineup like a safety net you never step off. To make adherence effortless, anchor each dose to habits you already do. After brushing your teeth, alongside morning coffee, before lunch, at bedtime. Use a simple checklist on the fridge or a phone reminder. Keep a spare set in your bag for days away from home. and never stop early even if the eye feels calm, because symptoms often lag behind physiology. Appointments matter just as much, since your surgeon will measure pressure, inspect the bleb or incision, adjust steroid strength, add or taper medications, and refine the plan based on how your eye responds. So bring every bottle to each visit and note any side effects or missed doses to give the team a clear picture. This consistency protects healing, reduces the chance of setbacks, and sets you up to recognize and act on early warning signs before they threaten the outcome. Mistake number 5. Ignoring warning signs. Recovery can unravel when early alarms get brushed aside, because with ocular healing time is critical and a wait-and-see approach may turn a manageable issue into a vision-threatening setback. Symptoms that call for prompt action include sudden or intensifying pain, a rapid drop in clarity, halos around lights, new floaters or flashes, a shadow or curtain drifting across part of the view, marked light sensitivity, increasing redness or swelling, thick or foul discharge, headache with nausea, or fever, and any cluster of these signals warrants immediate contact with your care team. Keep your surgeon's number saved in your phone and posted where you can see it. Call as soon as something feels off. Request same-day assessment. Avoid driving yourself. Keep the protective shield in place. Continue your prescribed drops unless told otherwise. And if you cannot reach the office quickly, use urgent care or an emergency department and state that you are in the immediate postoperative period after glaucoma surgery so triage routes you to an ophthalmic exam without delay, fast. Reporting preserves pressure stability, blocks infection from gaining ground, and protects the outcome you just earned, which naturally sets the stage for planning a safe, gradual return to exercise and favorite hobbies. Glaucoma surgery recovery does not lock you to the couch because easy walking supports circulation, steadies mood, and keeps energy moving. Yet this phase rewards restraint since yoga inversions, heavy lifting, high-impact drills, and contact games can drive eye pressure upward and strain delicate repairs. So treat the eye like a traveler on a short holiday and choose relaxed strolls, gentle range of motion for neck, shoulders, and hips, and low-effort pastimes that keep the head above the heart. Then, step up intensity only after your surgeon gives a clear green light, which preserves the result you worked for, protects vision, and helps your daily routine settle into something comfortable and sustainable. Now you have a clear picture of the 5 slip-ups that most often derail glaucoma surgery recovery. Unnecessary strain from lifting or bending, moisture or makeup or unclean hands near the eye, rubbing or sleeping without a shield, gaps in drop schedules or missed follow-ups, and delaying care when warning signs appear. And if any of these sounded familiar, you're not alone because everyone slips into old habits. Yet the moment you commit to steady routines, the outlook changes quickly since consistent postoperative care with sensible lifting limits, head above heart posture, clean hands, a dry protected eye, faithful use of antibiotics and anti-inflammatories, and prompt calls when something feels off builds a safety net that guards pressure, calms inflammation, lowers infection risk, and preserves vision so you can return to daily life with confidence. If this guide supported you today, add a like, share it with someone preparing for surgery or navigating the early days of healing, and subscribe with notifications on so future eye health tips arrive right when you need them. And because progress sticks best when you keep learning. Continue with the next video appearing on your screen and carry this momentum forward into habits that make recovery smoother and long-term vision protection stronger.